TMD, or temporomandibular joint dysfunction, is dysfunction in the jaw itself. A lot of times it is caused due to a muscular imbalance from side to side, and it can be mostly caused from grinding your teeth or clenching during the day or at night. Causes of TMD are typically tension or pain in the muscles of the jaw joint itself, pain when chewing, grinding, talking. So typically what we look for in patients who have TMD are dysfunctions on opening of the jaw. So the jaw will deviate to one side versus the other instead of opening straight. And you'll also notice tension or knots in the muscles of mastication. So the muscles here and the muscles here. A lot of patients with TMD we find clench, bite their nails, or grind their teeth throughout the day or night. A lot of patients with TMD also have corresponding tension headaches. So when our patients come to us and they have lack of mobility in the neck or tension headaches, we often look at the jaw, and we will find typically TMD even though they don't have any pain in the jaw. So a lot of the treatment that we do for TMD includes manual therapies provided by us. So we work on some of the tightness in the tissues of the muscles of mastication. We'll do stretching, we'll do manipulation of the cervical spine, as well as some manipulation of the jaw. And then we do a lot of exercises and stretches to help release some of the tension and correct that jaw opening and that jaw position. And then as well as treatments like acupuncture and dry needling to help really decrease the stress and the cause of the clenching and the grinding in the first place.
All right, so what we're gonna be looking for here is any kind of deviation of the jaw. What we're gonna do, just kind of I wanna feel the joints. I wanna feel how, if there's any popping or clicking going on. So what I'm gonna have her do is just slowly open her jaw as wide as she can go. She's gonna close. Okay, we're gonna do it again. Okay, so there's a little slight deviation to the left here. So you'll notice when she gets down to the end of her opening the jaw, it kind of shifts a little bit this way towards the left. But also, you may not be able to see it very well in the video, but this side will tend to kind of click or shift last. So we always look for what we call last or least. So in this case, go ahead and open one more time. Yeah, so right there at the end, you see that little shift. Yeah, perfect. All right, so first what we're gonna work on is the 4 muscles of mastication. The first muscle is what we call the masseter, right here on the side of the jaw. So what we'll do is we'll just kind of palpate the jaw, we'll pin it down, looking for trigger points here, okay, and then she'll just slowly open and close. Okay, slowly open and close. Okay, once more. Okay, good. Now what we'll do next is work on the temporalis muscle. So over top here, open. Good, open. Okay, again, good. Okay, the third muscle of mastication is the anterior digastrics, right underneath the jawline. So how we'll get this one done is open halfway for me, and you're gonna jut your chin straight up towards the ceiling. Good, halfway open, jut up towards the ceiling. Okay, one more, open halfway, jut. Good. So this whole time what we're doing is just continuing to look for trigger points, looking for the tightness of the muscles. The fourth muscle is what we call the lateral pterygoid muscle. It's actually the best way to contact it's intraoral. So what we'll do is we'll tend to glove up, have the patient open the mouth, close the mouth. So once we kind of look around, palpate that muscle, pin it down, and then have the patient open the jaw as wide as they can go. Open, open, open. Good, close. Okay, open, 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 open. Okay, and one more. Good, okay. Then what we'll do is we'll tend to switch to the other side, do the other side as well. All right, so what we'll do next is we'll use this little activator tool. It's just a little clicking tool that helps us adjust, kind of restore some motion to the joints. So what we'll first do, fill the joints again. I want you to open, close, open, close. So what we'll do is we'll start on the joint that, like I said earlier, moves least or moves. We'll start with the joint that tends to move least or last. Okay. So what I'll have her do first is look to the left for me. She's gonna open the jaw halfway. Hang out right there. Okay, good. Then we're gonna look straight back up. And we're gonna recheck. So I want you to open the jaw again. Close. Good. Open again. Close. One more. Close. Good. So her left side still doesn't move great either. So what we're gonna do is we're also gonna do the left side. So look to the right for me, please. Open halfway. Okay. Last time, we're gonna recheck. So open. Close. Perfect. All right, the last thing we're gonna do is mobilize the jaw a little bit. So again, we're gonna glove up. Okay, we're gonna open the jaw. Good. So what I'm gonna have her do is just kind of relax, let me have the jaw. I'm gonna kind of move it through its range of motion. Okay. I'm also gonna have her at this point resist the opening. So I want her to kind of just hold the jaw there in that position. Don't bite me. Okay, and relax. Okay, good. Excellent. Now we'll just recheck. Okay, so last time, let's open and close. Close. Good. Nice and straight now. There's not a huge jump at the end of that. Both sides of these joints, both TMJ joints, seem to be kind of rocking, opening at the same time. So that's what we're looking for. Perfect. And that's the treatment that we typically do for the TMJ or TMD condition.
TMD. If you have it, if you know somebody that has it or you might have it, feel free to give us a call at 513-463-3011 and we can get it checked out for you.